Hey, Dr. Zeeshan, how are you doing?
Good, thank you. I'm good, Dr. Brony, especially today. I've got the news.
So what's up with the news? Tell me.
Yeah, well, great. I'm grateful that I passed the MCQE1 and on my I took my third attempt. And
Wow.
this is the first time I used your course because I felt I needed something extra to help
Okay.
me out because I was self-studying, doing question banks,
Yeah.
but there comes a time when doubt hits your mind. What to do next? I'm not familiar with Canada, but then I saw your course. I attended the free course,
Okay.
and I got a taster of how you deal with the situation and the teaching side of things. It was not
Yeah.
just you tell us the theory, we go home and memorize it. You were telling us the objectives of the MCQE1, and
Mm-hmm.
for me that organized my thoughts and gave me a lot of confidence.
Mm.
To how to approach the exam. And your courses, the videos, I was listening to them every single day. The med bullets, I studied that right before going for the exam, and I can tell you it's worked out fine.
Beautiful. Beautiful. So how long have you been in this journey, if you don't mind? How long has this journey been going on?
When you say journey, you mean the MCCQE1
Yeah.
or?
Yeah.
Yeah, so it's been about 6 months to 8 months. I've been trying to take this exam, and I took it in the UK. I came very close. I got 2 to 3. The pass mark was 2 to 6.
Mm.
So then I was broken, but I was like, I need to find a way to approach this. But then I came to Canada in October of 2022. So this journey has been going on for at least 8 to 9 months.
Beautiful. So was it that a friend told you about us? How did you get to know about us?
Yeah, good, good. So Facebook, I got to know by Facebook, but also I did some research about courses available online, and then I saw your free courses. And for me, I was very skeptical. I would have to be honest with you
Okay.
because I've seen many courses where it's just about telling you the exam, the book, whereas here you were analyzing each objective, and
Mm.
your energy, your smile, your words of pushing us because we
Oh
are
my
also
God.
we are students, right? We are students. We need a bit of a push
Yeah.
by somebody who knows, right? Because the exam can be daunting. It's a 6-hour exam, right?
Yeah. So what had you tried personally in the past, and how different was this particular preparation different from the past preparation you did?
That's a good question. So in the past, I was doing the ACE Q Bank and I was doing the USMLE World, as everybody advises to do that.
Okay.
But then I came close. I failed by 3 points. So then I started thinking, I need some help here because I'm nearly there, but I just need an extra boost.
Mm.
Then I came across your videos. I listened to the cardiology, the emergency medicine lectures about, and the pediatrics one, OBGYN, and you have on your each topic, there's also some small videos, each topic
Yeah.
discussed separately. That is a beautiful thing because you are taught, it's like from the horse's mouth. And if you listen to it before the exam, that will help you tremendously. And it was also the med bullets, which is, it's like so much knowledge in so concentrated in one video.
Mm. Mm. Mm.
So all that videos, it's like listening to it again and again. But one more thing I have to mention is that
Yeah.
you have to have a good question bank, and
Mm.
that is where Ace Q Bank was also very useful.
Sure. Yeah. And like for me, my principle is that anything which will help you, anything which will help you in your journey, use it. But don't also spread yourself too thin. Make sure that you are using the right resources, make sure you're using the right guide. Okay. So going into the exam, how did you feel? And now that you had your results and now ultimately you've passed with a very good score, how do you feel as well? What's the difference?
Yeah. So the difference was that the feeling, obviously nobody's happy. Obviously you're always stressed because you don't know what questions you will get.
Mm-hmm.
Added on that lack of sleep, that's not a good combination.
Mm.
But the fact that I practiced so much the last 2 to 2.5 months, when
Mm.
I was seeing the question before the previous exam, there was some question where I would be lingering for because I don't know the answer.
Yeah.
I'm trying to guess. Whereas when you taught us about the MCQs, you gave
Objective.
us a good idea about how to answer those questions.
Mm.
So my skill to answer the question was improved because I had done the question bank, but also listened to all your med bullets and things
Mm.
like that.
Mm. So you're saying that this exam is not only about knowledge, it's also about skill. That's what you're trying to say.
And I think preparation is who is your guide, because you
Mm,
need a guide. This exam can be cracked if you're from the Canadian system, easy. But if you're a foreigner, you need a guide, and
mm,
that guide needs to know your perspective from a foreigner. And I think you, but I think I'm not trying to compliment you over the top, but I think your enthusiasm, your advice to read, you keep repeating certain things, and I find how you slow down for those who are lacking commit. Somebody doesn't understand the language, you slow down for them, you show patience for them, and you go through their doubts, and then you move on to the next question. You don't just rush through it. That's what I find your course to be good. Even your other colleagues, your ladies who teach us those courses, very patient, very careful not to go too fast, and
mm,
like that, the learning happens.
mm, mm. So, Dr. Zeeshan, assuming a friend comes to you, hey, Zeeshan, I don't know what to do. I'm in doubt, People are saying all sorts of things about Q1. I don't know what to do. What will you tell the person? Tell me 5 things you tell the person to prepare for
Well,
this.
yeah, obviously, self-preparation is very important. Medicine is about learning each ourselves.
Mm-hmm.
But to crack an exam like this, you need to know the objectives of the
So number one is
MCQ1. That's
objectives.
objectives, yeah, yeah. And you need for somebody to keep reminding you, because you might be getting in your comfort zone by just doing MCQ, a question bank. Secondly, the how to say, covering all the topics again and again, not just once, doing the question bank once or twice,
Mm,
but also going through all the subjects where you have difficulty. Read from the Toronto notes.
mm-hmm.
Toronto notes is a very good, I would say, it's the only resource besides the videos. And I would say to do sets of questions at 20, 25. When you do questions, don't just do one and then read the answer, and do one and read the answer, spend half an hour on each one. Go through a set of 20, 25, and
Mm-hmm.
then come back to the answers. Like that, you're covering a large amount
So you're talking
of,
about the
of
question banks, right? The
yeah,
question
yeah,
bank.
of the topics. So do a lot of questions, and then read the feedback after doing all 20 of them,
Sure.
instead of doing one by one.
Mm-hmm.
And then obviously studying Toronto notes,
Mm,
and also the ethical side of things, the ethical topics, right?
yeah.
That from the Toronto notes is very good, and
Mm-hmm.
you have a good question bank on your website
Mm,
about the different topics: cardiology, emergency medicine. Go through all of them,
yeah.
and honestly, it is a repetition.
Beautiful.
That,
Beautiful.
that leads to the final product.
Yeah. So how are you feeling right now?
It's
Today
yeah.
in your results have come. How are you feeling? Tell me.
Firstly, the results are 1 month late. So imagine that last 1 month was a torture.
Oh my
But
goodness.
when I got the result today, I couldn't believe my eyes. I was I was expecting me to be having a bad day, but I'm so grateful
Mm,
that all that hard work, all those hours, all those courses, all those nights I've listened to your videos have
yeah.
all been fruitful. And especially I would like to thank you and tell you how amazing job, how a nice person you are.
Yeah. Dr. Zeeshan, this thing means a lot to us. We want to see people smile. That is the main thing. We want to see people smile. We want to clear people's doubts. And I'm very glad that you trusted us to guide you through this process. So basically, what's your final word for anyone who is listening to you right now? What will you tell the person?
I would certainly say, to like your own words, trust the process.
Beautiful.
On day one, you might think you're lost and everything, but after going through your courses, the confidence will come.
Mm,
But listening to your words, you would know what to read, and you also show a lot of detail about what to focus on. So I would say listening to your advice,
mm.
and following your guidance, and accepting you as a mentor, because I think everybody needs one.
Sure. Yeah. A mentor will help you to scale things which you'd have taken months to years to scale, right?
But I think your personality has a big role to play in this, has a huge role. And
Sure.
thank you for being so good, so nice person.
Sure. No, no, we love to see this. We love to hear this, and we want as many people as possible to be helped so that, the pain of failure goes away. That is basically what we are hoping for. And, you know, I'm so excited for you.
And I'm happy that every single opportunity you could make us ask you question, you would say to us, let's talk about this, let's ask question. You're a very approachable man. And that is something rare in the courses because people are very busy. They're like, yeah, they don't answer. Whereas in your case, you get the response the same day, you know, from you.
And you have my phone number as well. So you can always reach out to me. And, you know, Dr. Zeeshan, I'm so glad. And I just can't wait. The future is now, you know, opening up, right? You've cleared your
absolutely, yeah. So many doors are opening now, and honestly, keep doing what you're doing. And I would love to be the advertisement. If I will tell as many people as I can, because there's a lady I met from Nigeria at work. She's like, I'm a doctor. I'm trying to become a doctor. I'm like, take this guy's name, MedCognito. Get in touch. You want a friend to push you. He's almost like a friend, you know.
Sure, yeah, and you know, I'm glad. You know, we've never met in person, but it looks like we know each other because of the.
I have heard your voice a lot. I can trust me on that. I have seen you a lot that you have seen me, you know.
Yeah, you know, someone said that at a point in time she'll be eating and then she'll say, let's go. And her husband will say, where are we going? It's like, I'm listening to Med Bullets, I'm listening to Dr. Pony speak, you know, and for me, this is awesome. So, Dr. Zeeshan, seriously, let's keep in touch. You know, I'll be here to cheer you on till the end when you finally, you know, get into a program and start your practice in Canada. I'm so proud of you. And
thank you very much.
Wait to see you at the top. All right.
Thank you so much, Dr. Brody. Thank you. Have a nice day.
I'm so proud of you.
Okay. Thank you so very much.